Welcome to the CNS Podcast featuring Dr. Daryl Inaba, Research Director for CNS Productions.
The important thing to remember is that when experiments were done with animals, and they found from the 1950s that mammals abuse the same drugs of abuse that human beings do and get just as compulsive as they do. They also found that there were other psychoactive drugs that affect the way the mind thinks and the way the mind feels and the way the mind perceives the world around them. But these psychoactive drugs had no ability to induce a repetitive or a need for an animal to come back and seek it out over and over and to continue using it when you put negative consequences in front of them to try and abate their use of it. And what these drugs were, what these psychoactive drugs were the major neuropsychiatric medications, the neuroleptics, the things for thought disorder, and most, not quite all, but most of the antidepressant drugs that are drugs that are used to control mood disorder, bipolar drugs. And so it's important for this field where we have a significant incidence of people with co-occurring disorders or people with both psychiatric as well as substance use disorder to realize that their recovery and their ability to maintain sobriety is really threatened unless they get their psychiatric problems under control, unless they get their schizophrenia or their depression or their anxiety or their personality disorders, bipolar. Unless those are addressed effectively, then the threat for relapse is very great. The thing to emphasize, though, is that there are the majority of these medications that are used in psychiatry that are non-reinforcing, that are non-addicting, and therefore very useful in helping to address these disorders without the threat of potentiating or precipitating relapse. The neuroleptic drugs, importantly, the Haldols, the Risperidals, things like that, are not reinforcing and can control major thought abnormalities, and at the same time maybe help a person maintain their recovery. Most of the antidepressants, the tricyclics, the serotonin reuptake inhibitors, norepinephrine serotonin reuptake inhibitors, and even the dopaminergic ones. There's dopaminergic antidepressants like Wellbutrin and Zyban, which work by emphasizing the dopamine system that are not reinforcing, do not cause addiction. The major problem comes when we're looking at the treatment of anxiety. When people have both anxiety, which is a real dangerous situation in which people, and it's very dramatically, go into a panic attack where they actually feel they're dying and their heart races, they sweat, they have a rapid pulse rate. It's a very dangerous type of situation. So it's a real huge disorder, and interesting enough, it has affects a lot of people. The thing about treating anxiety is the drug of choice, of course, in treating anxiety are the benzodiazepine, and they are the exception in psychiatric medication. The benzodiazepines are associated, the Valiums, the Libriums, Klonopin, things like that, are associated with a high degree of addiction themselves. They cause their own addiction, and they can precipitate craving and withdrawal. So we need to look at different things to treat anxiety in terms of people who also have anxiety and substance use disorder. But there are a lot of things. There are classic antidepressants. There are also buspirone, which many people don't like, but has the ability to control anxiety over a long period of time, and a number of other newly developing medications that can help suppress anxiety without stimulating the craving or the need to continue using it. So I think the best thing for people who have co-occurring disorders is to recognize they have the double whammy, they have the double trouble, and they need to aggressively address and treat their psychiatric conditions while at the same time maintaining continued work on long-term sobriety.
That wraps our pod for today. Thanks for visiting the CNS Podcast. Please check back soon for the next in the series and visit our website, www.cnsproductions.com.